talking about we're just coming out of dealing with food insecurities. And one of the things we've discovered about making a difference is we have to take risks. And then we know we have to be resilient, right? We have to keep working at it. So in this next topic, building resilience during these challenging times, our presenter is Gray Norquist, MD. Gray Norquist, MD is Vice Chair of Emory University's Department of Psychiatry and Behavioral Sciences, Chief of the Grady Behavioral Health Science, Chair of the PCORI Board of Governors, and Chair of the American Psychiatric Association Council on Quality Care. Prior to joining Emory, he was professor and chair, Department of Psychiatry and Human Behavior in the University of Mississippi School of Medicine. He served in several leadership positions as the National Institute of Mental Health, NIMH, prior to that time, including director of the Division of Services and Intervention Research, a division responsible for clinical prevention and services research for NIMH. He's been a member of several journal editorial boards, including Psychiatric Services, the Archives of General Psychiatry, and the Journal of Mental Health Policy and Economics, and received various national government and public awards, including the NIH Directors Award, the NIH Special Service Award, and the National Alliance for the Mentally Ill Exemplary Psychiatric Award. Mouth got tongue-tied. His research has focused on improving mental health services for underserved populations and development of quality measures in mental health. Ladies and gentlemen, on the topic of building resilience during these challenging times, Gray Norquist, MD.
Well, listening to all that makes me sound pretty old. I mean, so I think that, but the most important thing I think about my background is that I grew up in Mississippi. So I think, there are challenging things about being from Mississippi and having grown up there, but it taught me a lot about life. And so one of the things that I hope we can have some discussion is about that and how things change, but yet things don't change, and how that still continues to have an impact on people. So is it possible for me, having, as you can hear, all this time I've been in kind of academics and research, I love to show slides. So I'll try not to show too many slides, but it makes me feel less anxious if I do that. And I also want to thank Drs. Beatty and also Dr. Clyde-Glenn for inviting me. I mean, the problem with speaking at this point is there have been so many great speakers, I really kind of put myself on the spot here. So don't expect much for the bar to be very high here, given all the great speeches by the other folks.
Mm-hmm.
So
Grace, you're a co-host, so you're able to share your slide.
Okay, yeah, great. Sure. So let me do that. And let me just be sure if everybody can see this. Why is my slide? Okay. I hope you can see this. Can you see? Okay, good. All right, so that's me. You've heard about who I am and Chief. For those of you who don't know, Atlanta, Grady is the main public hospital here in Atlanta, and we have a very large outreach to our community. One of the reasons I came here is because of this opportunity. As you heard, I really have spent my career working with underserved populations and trying to improve mental health for people who are traditionally underserved. And so we have a great opportunity to do that here in Atlanta because we actually serve most of the Fulton County and kind of DeKalb County surrounding metro area for Atlanta population. Okay, so you already heard some of the disclosures here. Actually, I've just rotated off with the Patient-Centered Outcomes Research Institute. Fortunately, that's one less job I have, so I'm not with them, but I feel like I have to say that I would have some conflict if something came up about that. So here's a little bit about what we're going to talk about. We're going to talk about the causes of adversity and the need for resilience. I think we all know we need some resilience. What is resilience? How do you develop it? And then the importance of acting now. The objectives, this is kind of summarizing that as well. What has been the impact of COVID-19 and other recent stressors on mental health of the population? What factors have impacted the development of resilience, and how can one improve personal and community resilience? one of the things I want to make a point about in this talk is that we often talk about how we personally can help ourselves, but one of the things we always miss is the importance of the community and the context in which people live, and that oftentimes when people talk about resilience, they don't talk about developing community resilience. So you can fix yourself, but without fixing the community, it doesn't kind of all work. So that's a point that I want to make, and as someone who's trained in public health, I think this is really a critical issue, that we really focus a lot on the environment in which we live and really work hard on that as well. Okay, so I'm going to pepper a few questions through here. And as somebody who's been at teaching for a long time, as you probably recognize, some questions are kind of trick questions. So it's not necessarily a yes or no answer, but I want you to think about this. It's the reason I put this in. So the statement is COVID-19 was a primary stressor this past year. And so you can either think to yourself, is that true or false? And think about it for a minute, because if you listen to if you just were thinking about what I was saying about the context in which you live, for some people, COVID-19 was not the primary stressor, or for some people, it was but one piece of a stressor. So let's talk about what the impact of COVID-19 and other recent stressors. So I'm going to go through, but I'm going to list here for you. So COVID obviously was a big impact for a lot of people, not just the disease, the acute illness, and some people who've suffered with chronic illness and what that impact has been for them. And of course, there are the non-disease impacts, right? People lost their jobs, there were economic problems, there were educational disruptions. I mean, there were a variety of things you can think about by having a pandemic, what that caused. So when you talk about COVID-19 was the primary, what particular aspect of it? Some people who, let's say, are quite wealthy, they didn't have economic problems. They didn't have some of these other issues. And for them, the impact of the fear of having the disease and ending up in a hospital was more of a stressor for them than perhaps for other people, where the economic fallout and stuff was much more of a stressor for them. But in the context of COVID, there were other stressors that were going on this past year, which we all know about. One of the primary ones is the continued problem with racism and bias in our society. And that's not something, you know, several of my friends and I have talked, and I've had people talk about COVID, at least the disease, we have an answer to now. We have a vaccine that we think is quite protective. You've already heard about that. And we are on the road to getting some antiviral treatments. I've been around a long time. I haven't seen that we've solved the racism and bias issue yet, and that's a ways to go. But if you talk to a lot of people, that has been a major stressor for them over this past year, particularly with George Floyd and a number of these other things that have re-emphasized this problem that we have with our society. So when we talk about this past year, it wasn't just the COVID, but there were other things that were quite stressful. And if you start to add these things up, you can imagine the impact on certain populations who have more impacted by some of these than other populations. Another one was this incredible year of the political turmoil that we have and what that's done to us and the stress of that. So I had some friends who were more disturbed in this past year by the whole political turmoil of the last year and the things that happened than they were by any of these other stressors that have happened over the last year. And then there are the other stressors that go on for a long time. Here at Grady, we have a very large program in treating people who've suffered from trauma, particularly domestic trauma. So probably 50 to 60% of the people that we see in our mental health clinics have been exposed to trauma and continue to be exposed by trauma, and that we work with them. This is not something that has gone away. I remember my experience when I was the chair at Mississippi. One of the things that I did was start a large telehealth network in the Delta, long before telehealth became a big thing to do. And we went to the Mount Bayou Clinic, which many of you know there, and we're talking to them about how we could work with adolescents, these young women who were pregnant, but had also suffered from trauma and had domestic abuse, some who were pregnant because of being raped by somebody or something like that. And we started to talk about that. And as we were talking about it, several of the people who actually worked there said, well, we would like for you to offer us services because we've also suffered from trauma. So I think one has to understand that, you know, this is a problem that has impacted a variety of people for quite some time, and unfortunately is still going on. So if you think about some populations this last year, these stressors, all of these impacted them at once. And think about the immense amount of kind of trauma or experience of stress for them as opposed to some people who might have been affected by one or two of these. So let's talk about COVID-19, in particular about some of the impacts it had. You've heard a lot about that today, so I'm not going to go into detail, but I want you to think for just a minute. Imagine this, that we've had over 34 million people infected, but 600,000 people have died in the United States alone. And if you think about that, that's an incredible number of people who have died over the past year. Job loss, you've already heard about that, and we know that that's impacted some groups of people more than others. There's the loss of educational opportunities. I mean, what this will do to children is still unclear, but this loss of impact, and certainly on certain kids who did not have access to some of the technological opportunities that they might have to learn, that's been a big problem for them. And there's certain school districts where they couldn't offer some things that other school districts could. So what the impact of this is for educational opportunities for kids is still to be determined, but we know it's had a negative impact. The other thing is this lack of family and social context. How important, we all know, and when we talk a little bit about how you build resilience, communication, contacts, these kinds of interfaces with others is a key component to helping one develop resilience. We lost all that this past year. Just remember what that was like, not being able to see family, have your usual social contacts. Yeah, you could do Facebook and stuff, but that's not the same as actually giving somebody a hug or just being able to see them in person. The other thing that we've seen is this increase in risky behavior. Substance use and alcohol use and a variety of other things have just gone up. I mean, there's no question about it. We have a lot of data on that, and we're seeing that. And the impact on people that that's caused has just been incredible. There's also been a decrease in available treatment resources. So there have been these increases in ED visits for mental health across the country, particularly for children. And there's evidence that adolescent young women are actually may have shown a spike in suicide attempts this past year too. So I think there are a number of other impacts of these things that have just, you know, reverberated across our entire communities. And then, of course, there are these exacerbations of already inequities that we have in our healthcare system and our educational system. And this has just compounded these problems that were already existing there. And then the other thing is, of course, this increase in negative health outcomes unrelated to COVID-19, where people avoided getting screenings, avoided getting treatments, or they just weren't even available. So we've seen an increase in cardiovascular disease, as I've already said about suicide attempts. And then the impact on caregivers has been tremendous for parents of the kids, for people who caretake of older people, or even in their own homes who might have suffered from COVID or other kinds of problems. The impact on caregivers and their mental health has been unbelievable this past year. So let's talk about obvious things that we talk. So these acute events over the last year that have raised and heightened the awareness of what racism and bias has done in our communities and how that impacts people. We know very well that racism has an impact on health, on your own general sense of well-being. And then there, of course, the chronic. This is not something that just started this last year. I mean, you know, there's been some, as I say to my white friends, yeah, you woke, so to speak, when George Floyd, but if you talk to many other people who've suffered this their whole life, this is not a new problem. This is a chronic problem. It just became aware to you because you didn't pay attention to it before, but this is a chronic stressful event that unfortunately, I'm afraid we have a ways to go to fix that. And of course, the other factors, the other stressors have actually made this worse for many people, as I just pointed out. And then there's the political problem. There was this sense of a decrease in your sense of safety after all of this kind of turmoil we had in the political issues this last year. This loss of community and this fracturing of our population. And that still goes on to this day. And somehow, and we're going to talk about this in a minute, is how do we start to repair this? Because if we don't, it's going to be a continuing kind of trauma for folks as we move forward. Other stressors, there's, as I've already talked about, this exposure to trauma that's been going on for some time, abuse. There's been also, we've recognized in the past year, an increase in domestic abuse and a possible increase in child abuse. One of the reasons I say possible is we don't have good information on that. Why don't we have good information? Because where we get that is when kids go to school. where they're reported, and kids have not been in school where they might be able to tell a counselor or someone else. So we don't have good data, but most people believe that this is going on, that there is more child abuse. Kids have been at home. Parents or whoever their caretakers are might have been stressed out. There are well-known stories of people starting to use more alcohol, then they start fighting at home. And so you can imagine this kind of stress in a home and what it's done to some children. And then, of course, we all know about adverse childhood experiences, what this whole group talks about. But you know, and you've known this for quite some time, that these kind of events in children can lead to adult problems. I'm an adult psychiatrist, and what I always tell my child psychiatrist and my other child psychologists and others is that please try to fix the kids before they come to me. I don't want to keep trying to fix the thing when someone gets older, right? Some things start when you're adult, and I'll take care of those, but let's not keep moving these things across generations and me having to deal with these as adults. But we do know that adverse childhood events, there's very clear evidence on this, can lead to chronic physical disorders, drug use, and a variety of other problems. So it's critical that we address these things early in life and try to focus on them so we prevent this. Okay, so here's the next question. Think about this for a minute. Resilience is something I need to learn. Well, of course, you would think the obvious answer is yes. But guess what? We all have innate ability to be resilient, some more than others, right? So the issue here is not so much, do I need to learn it? Everyone can benefit from some education to bolster their resilience, okay? But the point is kind of like, for those of you, I'll age myself, for those of you who've seen The Wizard of Oz, you know, it's like the wizard says to basically, you know, you already have a heart, you already have this. And basically, you already have resilience and the capacity to be resilient, or you wouldn't be here now, particularly as an adult. But there are things that you can learn to be more resilient. And I would argue there are things you can learn to improve community resilience, because that's where I want to focus in just a minute. So what is resilience? There are a number of definitions. I'm not going to read through these, but basically it's this ability to recover from or adjust easily to misfortune or change, adapt to stressors over time. And this is kind of the American Psychological Association, but you can see they all come to this ability basically to recover from some adverse event. And there's these other terms like grit, fortitude, and endurance. Almost everyone has it. We just have it at different levels. Here are some signs you have it. You kind of have a positive sense of yourself. You have an ability to move forward when you have these adverse events and make plans. You can avoid using substitutes like, well, I'm just going to drink myself out of this, or use drugs or whatever. And you seem to be you feel yourself being somewhat calm under pressure. So you've had enough pressure events, you can learn to kind of be calm with it. And there's this realism about coming to terms with what really matters. It's kind of like, you know, let that one go or whatever, but it's how do you really, without that ability, if every little thing that stresses you becomes a major issue, it's very hard to move on from that. Why do you need it? Well, I've already kind of pointed that out. Without it, you're more likely to get into other kind of alternatives like drugs and alcohol. Being more resilient makes it easier for you to learn and to work, and you are more likely to be engaged in your family and community. And guess what? You have better health. It's very clear that people who tend to be more resilient and can get past these stressors have a lower mortality even over their life. How do I get it? Well, here's some things that don't help. Just keeping a stiff upper lip, as they say, or using something to cover is not helpful. That in the long run is going to be a problem for you. So how do you get it? What really kind of works from an individual? So there are four main areas if you look at all the research and stuff, and they kind of talk about this from an individual level of how do you get resilience. That one thing is this ability to connect with family, connect with the community, whatever. This ability to reach out and doing more of that clearly builds resilience. It's a connection with others, right? So that's a key component of how you build your resilience. The second thing is this increase in kind of wellness for yourself, right? So one of these techniques like mindfulness, how you learn to kind of relax and experience the day and try to avoid the negative. That is another key component of how you build your resilience. So there are kind of four legs here, and two of them is this ability to connect, reaching out and connecting, and increasing your own sense of wellness. And the third thing is being proactive. Make a plan, have a purpose. That what really makes a difference for people who are resilient is this sense of purpose in life and a meaningfulness to life, to the future, that the future has some meaning to it. And then the fourth thing that seems to help is write it out. Actually, just write out your plans, write out what's bothering you. It's amazing how much that can actually help. And I have a lot of patients who, for example, worry about a lot of things and they can't sleep. And one of the things we do with them is have them write all the problems down in a list and maybe some solutions before they go to sleep. And it's amazing how much that kind of relieves them in some sense and helps them. But as a kind of a plan out, remember, as I said, have a plan kind of work out. Just writing it out just by doing that seems to have some effect. And then, as we all would say, if none of this kind of works for you and you're still having problems, then get professional help. But I always add in the faith, because I think that faith leaders can be incredibly helpful. And those of us in the mental health field often talk about how you got to talk to the mental health person and stuff. But I've worked a lot with faith-based groups, and I've also worked with ministers and priests and rabbis and others, and I found them to be quite helpful for people. And if that's what helps you, then that's where you should go. And I think sometimes both is good. You get a specialist and a faith-based person and several, why not, right? So I don't want to ignore the fact that the faith is very important for people as well. And the big point here is how much you need and how much you need to help with will depend on the context and what stressors are particularly impacting you at any given point in time. So let me say a few things about children and what we know that helps children. And this is probably, this particular point is most critical for children, is having a supported environment. If you do nothing else to try to help a child be resilient, it's giving them a supportive environment. Now, that means a lot of things, right? So they don't necessarily have to have, both parents, whatever. It just means the kid has got to feel that he or she is in an incredibly supportive environment. But that does not include just the home, it includes the context in which the child goes out. So for most kids, it's school and what the school is like and how supportive is the school and other areas around it. Help the kid make connections, right? It's the same thing with adults. Give them a sense of kind of helping others in some way to get engaged and try to do things. And maintain a routine. That's really critical for kids, that they have a routine. That's one of the things that has caused a lot of problems with kids over the last year is this disruption in their routines, particularly their school routines and the other things they did, their play activities, other kinds of outside activities have been disrupted. So they've had no routines. And this sense of learning themselves to kind of take care of themselves and having help them understand how to set reasonable goals, take a long-term view instead of, these next 10 minutes, if this isn't done, my whole life is over, basically. And this fostering of a positive self-esteem. So here's the next question. If I develop personal resilience, I'll be fine. So think about that for a minute. Yes, in some sense, yes, you will be fine personally, but maybe not, because it depends on the context, right, and the environment in which you live. And if you don't do something to help change that context and the environment in which you live, then even though you've done everything you can to feel personally much more resilient, it's very hard to maintain that without some change in the environment and context in which you live. So now comes the community resilience. This is the point that I wanted to get to, because often when people talk about resilience, they don't talk about the community and the importance of building community resilience. So what this is a social and cultural environment and how it impacts our personal resilience, right? So that's what I just talked about. What you're trying to do with community resilience is changing the odds so people have more opportunity for a better future, right? If you sense that you do not have an opportunity for a better future, then what's the purpose, right? Why would you want to stay around and be in the place where you don't think there's at least some opportunity for a better future? So working on this sense of the community and building community resilience is changing this odds so you personally and others feel that you have more of an opportunity for a better future. And so that means you've got to improve the social, the cultural, economic, and political environment and context to make a better future that is meaningful. So you can see I talked about these different stressors, right, that we still experience, even though COVID is here and will probably go away, it will go away at some point, we still have the other social, cultural, economic, and political stressors that will remain. So how do we do it? What do we do? So early, for kids particularly, we need to have early interventions for school. This is this preschool. Now I'm going to start to sound a little political myself, because guess what? Some of the things I'm talking about sound a lot like the infrastructure package that Biden and Harris are trying to put out there, right? But they're simply addressing issues that we all know need to be dealt with at this point. So the more we can bolster early, right? I told you, I really would appreciate it if the child folks would help these kids early on so they don't grow up to be adults with the issues. Less costly educational opportunities. It's not going to be feasible to have reasonable, good educational opportunities if we don't make them less costly. And that starts to get into this, how do we sponsor and how do we help people pay for college or these other kinds of things like that. And the other big issue is this investment in healthcare. If you're not healthy, you can't learn, okay? And so this gets into the critical issue about we have got to provide people healthcare, but quality healthcare. And so that's been one of my passions over the many years. It's not just giving people health, but it's giving them good healthcare, right? So I can set up a clinic, but if this clinic offers nothing or gives poor quality care, that's not going to help you. And then this general infrastructure improvement, which is important. So one of the ways I like to look at it is it's a good idea to plant a tree. So what we're going to do is go down the letters of the tree here, and I couldn't come up with the making the tree work, and so I came up with total health. So the issue here is that we've got to improve our infrastructure for all health. It's not just physical health, but your mental health and the rest of your health. So we have to improve our infrastructure to provide health care for the whole person. The next part is the residential and housing. We've got to prove the housing issue. I work here in Atlanta. Many of our people are homeless who come to see us. So the issue has been that they have no place to live. If you don't have stable housing, you really have a major problem, right? You cannot really be considering yourself as having a meaningful future without some kind of stable housing. The stories of people who live on the streets are just incredible. The fact that they're still resilient and even can move around with some of the experiences they have on the street are incredible. The other part is education. We've already talked about that. That's the first E in our tree. And then, of course, economic. We have to improve the financial being of people. We've got to bring people up so that they have the finances in order to afford housing, to have health, and then, of course, education. And then I add this fifth, so we're going to have a tree with 3 E's, and for the teachers, I apologize for misspelling a word, but I think this fifth E is the most important, which is equity. We must improve this ability to have an equitable landscape for everyone. And if we don't get there, we're going to continue to have problems. And I think, to me, this E is the most important of all, because I really believe that without this and addressing these issues of inequities, it's just impossible to move forward. And let me give you an example of one of the things that happened this last year where this became so evident with us. So most of you probably know that there was an explosion in the use of telehealth for medical care. And everybody said, oh, this is great, we've improved access, people can get their care. And actually here, Grady, we improved access for a lot of people who even in the city can't get to the healthcare setting. But the other thing that became very evident is, guess what? A lot of people don't have a phone. And a lot of people, even if they have a phone, don't have a broadband plan that will allow them to do telehealth. So we ran into these inequities. The same thing the schools faced, right? So the schools found a lot of these kids didn't have a laptop they could take home, or even if they were at home, they didn't have a broadband access that would allow them. So now we've made these inequities even worse in this kind of thing. And that's why this infrastructure is so critical, particularly around these kinds of technological issues as well. But we can go down a whole list of other inequities that occur all the time. And that's why I think these things are so important to address. And then I want to say something about how do you build a community? So I have people who say, oh, well, I don't really want to get into big groups and work, in these community groups. But they're different levels. You as an individual can help build community resilience by working with one person, helping that one person get a job, get someplace, help them get to the health clinic, do whatever. Just an individual thing like that among a variety of people has a big impact, right, in a population. You could also be at the group or community level, your church group, whatever, and do more community work that way. Or you can run for mayor, you can do these bigger things, right? And do it more at the macro level, as we'd say, as a policy. But there's a role for you in each one of these phases that you can have an impact on. And remember what I said earlier, it helps improve your individual resilience if you get involved with this and have some sense of purpose. Why now should we do this? Well, the issue is if we don't do it now, we're all going to be in serious trouble, right? So it's important that we do this because of the impact of these problems over the long term. And the need to avoid developmental problems for children, I've already pointed that out. And we've got to restore the village. Our village is not working now, it's broken. And if we don't restore it, none of us are going to be in good shape as we go forward. So let me make some summary points and then I'll open it up for questions, because I hate to talk to people, I'd rather hear from people. There are many stressors in life, we all know that, but I think sometimes some seem to be more paramount or get more news attention or whatever than others. And there are these others that kind of underlie all the time that sometimes are actually the most important that we forget about. Everyone has the ability to be resilient, and the environment matters because it has an impact on you personally, obviously. And if you don't address that as well, you will never, the community and you as a whole. And we need to build an individual and community resilience because they're dependent on each other and we're dependent on each other. And the whole thing is important for our future population health. So I'll take questions. That's my email. If anybody wants to email me or ask a question about anything, actually, I can't answer some things, but I'll do what I can. And if you need an advice about what to do if you come to Atlanta, I can also do that for you as well. So anyway, that's kind of my presentation. So I'm open for any kind of questions that anyone may have at this point.
Thank you so much for all of that information. And I think one of the most important things, I guess, for all of us to remember, I shouldn't say that, I'm going to say for me, one of the biggest things that I took away from that was the building of the resilience and knowing that, you know, I'm not alone. I feel like I can't take it all on by myself, but when I am building with a community of people in different areas and we're coming together for the whole to make it happen, then yes, you give me hope that, again, I can be part of the change and not sit back and go, but what can I do? So thank you so much, Mississippi gentlemen, for your wealth of information and your continued work. I mentioned earlier, and I'll mention it again, that we are dropping those links for your surveys. So make sure that you go to the chat while we're looking at questions for, let's see, how do communities link with comprehensive building initiatives?
Yeah, so that's a good question. I think you have to find out what's happening in your community. One of the things that we've tried to do here, for example, we have reached out to, for example, so we don't do our own housing, but we have so many people who need like housing opportunities. So what we've started doing is working with groups who are in that. And we've also reached out to philanthropy organizations to try to put some money into this. One of the things that I learned, so I love to tell the story about when I went from NIMH, so I was in Washington, DC, and I went back to Mississippi to be the chair of psychiatry. And, you know, I used to have this map behind me when I was at the NIMH of the United States, because I said I worked for the US population, right? And there's this old saying about people who go from the government is that, you know, I'm from the federal government and I'm here to help you. And then the people would break out laughing because the idea is that the federal government doesn't help me. You know, you just try to tell us what to do. So I remember going up to the Delta, and it was actually at the Mound Bayou Clinic, and I was talking to them about some ideas of what I thought might be helpful, right, that they could do to try to improve mental health and stuff. And I remember this woman stood up, and I knew I was in trouble because the leading line said, "Honey, bless your heart." And I thought, oh man, I've made a big mistake when she said, "Bless your heart." But that's not going to work. And so I thought, well, That's a good point. So I said, well, what do you think would work? And first off, she was shocked that I asked her what did she think was going to work. But the lesson you learn from that is the problem we often have is this top-down approach. I know what's right for you, and let me give you advice on how to do that. Instead of talking to the people who are on the front line and on the ground, like what really would make a difference? So that's one of the things that we've done here on the housing thing, is that we've gone to people on the front lines. What keeps you from going into these places? What is the problem? What's the barrier? And so, you know, people are often concerned. A lot of people say we should build these shelters, right? I don't know if you've ever been in a shelter in a major city. These are not great places to be. There's drugs dealing going on. There's all kinds of stuff going on. And a lot of people say, I'm not going there. I'd rather stay on the street. It's dangerous to go in there. So we've tried to work with people to try to build the kinds of communities that people really want to live in, that you and I would want to live in, you know, and not think that you're just going to put people in that. So what I'd say is going back to this idea of engaging your community and what's going on and try to invest people in that. And I hate to say this, but sometimes you have to use the wrong kind of methods, right, or appeal to people in order to get what you want. So one of the things that helped drive some of the housing here in Atlanta and find places for people who are homeless is they convinced the business community that they didn't want homeless people in front of their corporate headquarters. And so then they were ready to put the money in. And I have this good friend there in the Delta, Freddie White Johnson, who some of you may know, who runs the Fannie Hamer Foundation, has just done incredible stuff. And she tells me the story about how I don't know, she'd probably have a fit if I told this, but basically that for her to get that land that she's building it on and the guy that gave it to her. And so she figured out that what she had to do was get this guy a cake for his birthday. And so she got this cake and sang happy birthday to him. And after that, it was that personal connection. And he basically gave her the land or gave it to her at a very reduced cost. So, I mean, there are things like that sometimes, but you have to know in your community what works, right? So what kind of works to kind of, as they would say, you know, grease the wheels or whatever to make something actually happen. So, that's a long about way to kind of answer this, but I think there are things like that you can do and interface with groups that already are reaching your community. So here I see somebody's mentioning about in Massachusetts where the hospitals have formed these community reinvestment groups. And so we've tried to do that to some degree here. We've actually built next to our hospital, we have a food. It was interesting to hear what your last speaker was talking about on food stuff, but we built basically a place where people can go and learn how to cook, and you can get a prescription for food. So we give people who have like diabetes and stuff, we give them a prescription and they can go over there and get like, you know, food items and things like that. So there are things like this you can do in your area.
And I like the idea of the tree, the analogy you used for the tree and what we should do, what you know, the acronym and what all of that stood for. But I guess I'm still stumped with, if we know that early education, if we know that getting things done early on this end makes a ton of difference in a lifetime, why is it so difficult to get those programs up and going, to get those investments by large on that end, so we're not faced with so many of the homeless situations and the people trying to build resilience for things that are constant in their lives?
Yeah, so, you know, it's the whole community that you got to build. And I think that one of the problems that we often see is people focus so much on, it's a school problem, so let's fix the school, right? Let's put money into this. But it's ignoring the economic problems in your community. It's ignoring the other kinds of social issue problems. And that's why I always think it's so critical to think about all the parts of the tree, right? Because if you don't attach the economic as well as the educational and stuff, it's very hard to make these happen. But I would say if I were focusing, and why I think what's so important on the infrastructure issue right now, yes, it's important to make sure that we subsidize and help people get college education. But if I were going to put all my money into something, I'd put it into the early phase, because nobody's going to get to college if they don't get out of the first or second grade, right? And if we don't do something about really bolstering that early, and there's very good evidence that Head Start and all these other kinds of programs like that have a big impact on advancing kids. So the only thing that I would add to that is this lack of healthcare in the schools. And we have several people here, Veda Johnson, who's a pediatrician here, and she's really been building these school clinics. And I've been actually astounded at how few schools and stuff have actual school-based clinics. And that I think that's a piece that's really missing. And when I was there, we started doing actually a telehealth connection with some of the Jackson public schools because we wanted to start offering like mental health services. And actually with Mount Bayou, one of the things that we were going to do with Mount Bayou before I left was we were going to offer telehealth mental health services to the clinic, because the kids, they don't want to go down to the community mental health center and have somebody see them walk in there, right? But they're willing to go to the Mount Bayou clinic and go in a little room where the psychologist or psychiatrist or other kinds of therapists could talk to them over the TV or something. And so we were going to start doing that, and then I left, and I'm not sure what happened with that. But those are other opportunities that I think are missing early on, because so many kids, and I was so struck by how many of these young adolescent women had had trauma and other kinds of abuse that nobody had been paying any attention to.
Never addressed. What role do you think teachers and parents play in these, or how are they involved in these individual programs?
Yeah, so obviously the parents are critical, right? And I think this is where the adult people come in. We have to help the parents. So one of the things that we're developing here, actually Dr. Johnson is developing, is what's called a family resiliency center. Because one of the things that the pediatricians often see is they see the kids, but then they don't know what to do about the parents, right, who have some problems. So it's like, how do you treat the whole family at one time, right? This is this siloing problem that we have, and why I think it's so critical that we put it all together. So what we're developing here in one of our primary care clinics, and actually we're looking for a philanthropist who may fund this, is to develop a center in which the parents, the kids, everybody gets help at the same time. And so I think that that's very helpful. Now for teachers, what I've figured out from the teachers is that it's kind of like also the primary care physicians who don't know anything about the mental health stuff, and they're scared to death to get involved in it. They just need somebody to help them. So in the medical area right now, we have these programs called integrated care or collaborative care, where we have mental health people collaborate with primary care physicians, who, when they have somebody like with depression, we collaborate with them. We give them advice about how to treat the person and let them do it. I think the same thing's possible with teachers. If they had somebody they could reach out to, and I think that would be a program that could be developed. You can even imagine in rural areas where you have a link through a telehealth connection for a teacher. Said, oh, I've got this kid, you know, I've got these problems. I'll call up the university in Jackson and talk to one of their or anybody like Dr. Glenn or whomever, right? So, I mean, you could, if they had a contract with them or something, and you could start to get some advice on what to do. But I think as oftentimes the teachers just feel inadequate. They don't know what to do because they haven't been trained in it, and they need some extra help with that. I'll tell you, that's another thing I've run into with the faith-based group, is that I've talked to a lot of ministers who say, you know, I know when somebody really needs help, praying on this is not going to make a difference. We really need some extra help, but I don't know who to reach out to. I can't get a hold of anybody. And, you know, it doesn't happen at 1 o'clock on, you know, Wednesday afternoon. It happens at 6 o'clock on a Friday night or something. And who's going to help me with that, right? So I think there's that need to develop some of that infrastructure as well.
We have a lot to do. There's a mention of in the Virgin Islands, the cost of property being so high because the vacation homes are driving the prices through the roof. So is that another, I mean, has that really increased even more with COVID as you've seen it, or is it just another one of those facts of life that we're just having to deal with and figure out how to fix?
Well, it's the problem, as I say, of gentrification. I mean, if you go to a place like where housing has become very expensive, we've seen it here in Atlanta. What happened in Atlanta, there's a wonderful west side part of Atlanta, close to where the Mercedes-Benz Stadium is. So they built the Mercedes-Benz Stadium, right? They tore down the other stadium, they built this. Then they started building a little bit more expensive housing. Now this is encroached on the other areas. And so is this gentrification stuff. So what happens is it gets very expensive. Then you get people with kind of not very wealthy who start moving into these less expensive areas. Then those prices go up, and then you happen. If you go to San Francisco, it's a horrible problem now because of the tech companies that have been there and have been paying these high salaries. My friends who work there at San Francisco General and is just totally changed the population. You have whole areas of the city that are just not recognizable anymore because it's become so expensive to live in the city that people have been moved out. And the homelessness problem in a place even like San Francisco that's heavily resourced is just become unbelievable. It's a huge problem. And I think in the Virgin Islands and other places like that, that's one of the other problems. You have these people spending money on these vacation homes, and in some areas where it's less expensive than, let's say, trying to buy land in Hawaii or something, you know, so they're buying in less expensive areas or where the tax benefit for them is. And so you run into this problem, and without a and this is where I've talked to community people who feel a need to protect their communities from this, because it's really disrupting your community. So here I've talked about building your community, having connections. Imagine what happens when that's all disrupted, as you have these people move in, you don't know each other, and now you've disrupted your whole sense of community and have to start over somewhere else. And that's very disruptive to people and quite stressful. And unfortunately, that was existing long before COVID and will likely go on after COVID as well, unfortunately.
What about the idea, I noticed a comment in the chats, and the idea of clinics that are focused on healthcare for the homeless. Are we getting more of those who are focused just on that, or more that you know, can receive money, federal aid or something like that, since this population is growing so?
Yeah, so there's more on that. I think here in Atlanta, we actually have what's called a street medicine program. So they actually have to mobily go out and find people, and they try to keep up with them and help them. I think sometimes the rural areas are a little better off because people kind of know the people home and they try to work with them. In a city, it's really tough because there are no connections, as people have no connections, and they can end up anywhere. And one of the other problems in cities is that people complain about the homeless, and so then the police go out, pick them up and move them somewhere else. And we've had that happen here where people get moved and we can't find them. We don't know where they went, where they took them, what happened to them. And here's the other problem, we haven't talked about this at all, is so many people end up in jail, and end up in jail for the wrong reasons. And one of the things we're doing in Atlanta is the old Atlanta City Jail, they're going to turn into a diversion center for people who have mental illness who've been ending up in the jail. And there's a great program, by the way, if you don't know about it, in Miami. We're actually a judge down there. He actually is a friend of mine. I just talked to him last week, Steve Leifman, who started this with his mental health court. But they took an old forensic mental health building and they got $40 million from Miami-Dade to repurpose this building into a diversion center where they will take people with mental illness, have them seen in a crisis, they have medical care. They're actually going to build housing next to it so people can stay there for a few months until they get back on their feet. And we're hoping to try to do something like that in Atlanta. And one good thing out of the COVID was this relief program, the COVID money, basically, as they call it. And there's money for every communities and stuff that have come out, and they're hoping to use some of that money to help us redesign our old Atlanta City Jail into something like that where we can take people.
I think that's a great repurposing. We have really appreciated all of your wealth of knowledge. And again, from Mississippi's own, I like to say that no matter where you roam, you are from Mississippi, and a lot of good things we know come out of Mississippi. Great questions, and I'm sure they'll continue to come in the chat area. Thank you again for that. If